Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, it's time for that moment of sharing and caring. And remember, sharing our med moments or our episodes of medicine that you have chest pain or knee pain or your gout is bothering you. Let's share that, because letting others know what our medical problems are and how they're healed, and letting our physician knows, it's all about health. Remember, life is so much better when you're healthy and caring. Let's care about each other. If you see someone in need, if you see you can do something for somebody, do it. Help them out, just because you can. Okay, let's talk. This is the Let's Talk segment. I want to talk tonight about breast cancer in men. It's not common, but it does occur. And what men are more prone to breast cancer? There's a particular syndrome called Klinefelter syndrome. And those particular patients, they are more prone to breast cancer. There's a gene, a mutation gene that can be tested for. It is the BRCA2 gene. And if your physician tests for that gene, if it's there, you may be a candidate, or more, maybe someone who is prone to breast cancer. Family history is very important. If your father had it or your grandfather had it, you may have a chance of developing breast cancer as well. And getting older, just getting older, increases your chance. Chronic liver disorder, heavy alcohol use, and if you had radiation exposure at an early part of your life, it increases that chance as well. Well, let's talk about common symptoms. Talking about nippling or lumping of the nipple, dimpling of the nipple, itching around the nipple, inverted nipple, or discharge from around the nipple. Any of these signs, you should see your doctor, because the chance of breast cancer is there. And I'm talking about men now, breast cancer in men. Well, our topic tonight is pediatric fractures. And I have the perfect person. I always pick great people now. I have the perfect person to talk about this particular topic. Her name is Flo Edibor Osula, Dr. Flo Edibor Osula. And she's a pediatric orthopedic surgeon. Dr. Osula, welcome to our show.
Thank you for having me so much, Dr. Bey.
All righty. Well, I'm going to start with my favorite question, and that question is, what is an orthopedic surgeon? Tell me about that.
So I'm specifically a pediatric orthopedic surgeon, and a pediatric orthopedic surgeon specializes in musculoskeletal issues related to children. So I take care of children from birth all the way up until around 16 years of age.
Okay, you said a big word there. You said musculoskeletal. Could you break that down for me?
Absolutely.
Right.
So musculoskeletal really refers to bone and joint issues. And that relates to, for example, if a patient has a problem with their knee, if a patient has a problem with their shoulder, if a patient has a problem with one of their long bones, such as having a fracture of one of their long bones. I treat those. I also take care of patients that have foot deformities, that have hip issues. I pretty much take care of anything related to the bones, the joints, and the muscles in children from about 0 to about 16 years of age.
Okay, all right. Now tell me, orthopedic surgeon, is there extra training that you need to do to get to that level to take care of the bones?
Absolutely, that's a great question. So after you finish, your standard medical school, you go and do a residency. My residency was specifically in orthopedic surgery.
Okay.
And that's a 5-year residency. After you complete your residency, most people take on fellowship training in whatever your subspecialty is. So my subspecialty is pediatrics. So after I finished my residency, I went on to complete a year of special training in dealing with issues related to orthopedics and pediatrics.
Wow, that's a lot of years.
A lot of years, it is indeed.
Okay. Now, I want to step back for a minute, because I treat adults, and I'm when kids come into my office, I don't go near them because I'm not comfortable with treating children, and it's a special. Tell me, I know sometimes I think that children are just little adults, but they always say no, that's not. Tell me how you deal with the child as far as orthopedics are concerned, and they're not little adults, right?
Absolutely. So my biggest thing, and the thing that I teach my residents, are children are not little adults.
Right.
They require special care. They require special attention. The approach to a child is different than your approach to an adult.
Okay.
So some of the things that I employ while I'm seeing patients is, number one, whenever I walk into the room, I always make sure that I address the child.
Right.
You want to always make sure that you develop a comfort level with the parents, because the child trusts their parent. So if the parent trusts you, then naturally the child is going to trust you as well.
Right.
Whenever I'm examining a patient, I make sure that I always evaluate whatever's bothering them last. If you just go right in and you try to evaluate if a child has a broken bone or has a sprain of their knee or whatever the issue is, and you just go straight to that extremity,
right,
then you're already behind. So there are definitely tricks that I employ when I'm seeing patients.
Okay, that's great. Now, with the body still growing, all right, and I know we're going to deal with fractures and talk about that, but is it a special way that you have to handle a patient with an orthopedic or a pediatric patient because the bone is still growing?
Absolutely. So children have what are called physes, or in layman's term, growth plates,
okay,
that are in each of the long bones of their body. So there's a growth plate at your knee, there's a growth plate at your hip, there's a growth plate at your ankle, and at your extremities throughout, your upper extremities throughout.
Upper arms.
Upper arms, right, upper arms. Thank you for correcting me. So
that's all right.
when you're evaluating a child and when you're going to treat a child, you need to be very mindful of that. For example, we're going to get to fractures, but if a child has a fracture, for example, of the long bone in their leg, the tibia bone here,
right,
in an adult, if they have a fracture that requires surgery, you can just put whatever instrumentation that you're going to use directly across through the bone.
Right.
But for a child, you have to respect their growth plate. So you're not allowed to violate it, because if you do, then it will affect their growth.
Okay, so they could actually have one leg large.
One leg will be longer than the other
if you affect that growth plate.
Absolutely.
Interesting, interesting. How do you handle the emotions of a child? Because obviously, if they come in and they're in pain, how do you handle the emotions of the child and be able to do what you do?
Absolutely. So I think, again, it's not only dealing with the emotions of the child, it's dealing with the emotions of the family.
Well, do you think the family's worse than the child sometimes?
Sometimes the family is worse than the child, and sometimes
I hear you.
the anxiety of the parent definitely can be transferred to the child.
I got
and
you.
so a lot of times what I do is I try and comfort the mom or the dad, or whoever comes with the child first. And if the child sees that mom or dad are comforted, then they can be comforted as well. Now that doesn't work 100% of the time. There are times where a child comes in and they're hysterical. And then the reality is that if you just give them a moment, let them kind of calm down a bit with the family, and then come back in the room and you can start your exam again. So it's just a matter of being patient, and part of that is, what we do as physicians.
When would somebody call a subspecialist like you in?
That's a great question.
Yeah.
So there are various conditions that require special attention from a specialist, such as myself. For example, I often see children that have club feet, which are basically turning in of the feet.
Right.
I also see kids that have issues with regard to their hips, and we call that developmental dysplasia of the hip. And basically what that means is that the hip is not necessarily sitting properly in the hip joints, and so that requires special attention from a pediatric orthopedic surgeon. Again, if a child has a fracture, an adult surgeon may not feel comfortable treating that fracture because they don't want to violate the growth plate, so they may send those patients to me as well.
I got you. And common conditions like, I remember when I was, I saw a young man come into the office with the mother, and they had their legs were like bowed, things like that. Do you handle, or how should I say, things like flat feet? You said down to the foot as well.
Absolutely. So I think one of the primary things that we do as pediatric orthopedic surgeons is a lot of counseling. A lot of the conditions that you just described, such as bowing of the knees or flat feet, a lot of those things are common and are commonly seen depending on the age of the patient. And sometimes what we do is just to reassure the family that it will get better over time. As the child grows, the bowing of the lower extremity will get better. Flat feet is not really a problem unless it becomes painful. So a lot of what I do is counseling families. Sometimes the pediatrician has already counseled the family, but the family wants to hear it from a specialist.
Right. I got you. Taking a history. Alrighty. How important is it to take a history from the understanding the patient and taking the history, and from the family taking a history in what you do?
Absolutely. So it depends on the condition. So I also treat children that have a diagnosis called cerebral palsy.
Oh.
So if I'm dealing with a child, and cerebral palsy is basically sometime during the perinatal period, there was either a,
I love it.
Sometime during the time around birth, delivery,
right.
A child has an injury to their brain.
Okay.
And it causes them to have, it affects their extremities in one way or the other. So when I see these children, they may come in to me for the first time being a toe walker, and no one has ever evaluated them for that diagnosis. And so again, what I do is counsel the family on what I think the diagnosis is, and we try to come up with a treatment plan together.
Is the duration that a patient may have a particular problem important as far as taking a history?
Absolutely. So, if I'm evaluating a child for something like a fracture, and they're coming in to the first time to see me again, if it's something that just happened, then I may put them in the cast for a certain amount of time based on that. If it's something that happened a few weeks ago, then they may no longer need that particular treatment. So it definitely affects how I manage them.
Okay. All right. Let's talk about trauma.
Sure.
And let's get to fractures where
that's why we're here.
Right. So I know that I have a son running around the swimming pool. Of course, you're not supposed to run.
Right.
He slips, and guess what? Breaks his arm. So I understand the hysteria of a parent and everything. But tell me about fractures and some of the things that you encounter as far as fractures of children.
Sure. So probably one of the most common fractures that I see in children are what we call supracondylar humerus fractures, and I will explain it because it needs to be, I know you want me to simplify things.
Went right over my head.
So basically it's a fracture of the bone here, which is the humerus bone, and it's a fracture that occurs at the lower level of that bone, and it's pretty common, and it occurs when a child falls into a hand that is outstretched. They're trying to kind of protect themselves when they fall.
Right.
Depending on the nature of the fracture, it can either be treated in a cast, or sometimes it requires surgical treatment.
Right.
Other fractures that I kind of take care of, and again, it goes from, the fractures can be clavicle fractures, which are fractures of the bone across the shoulder.
Right.
I also take care of fractures that occur in the femur bone, which is the bone that is in your thigh.
Right.
And I take care of fractures that occur in the long bone down here, which is your tibia bone. Again, because there are growth plates along all of those different bones, special care and attention needs to be provided for children that have those fractures.
Right.
Sometimes we can treat those fractures in cast, but sometimes if the bones don't line up appropriately, they need to be treated with surgery. And the age of the child also plays into that. If it's a younger child, a lot of times you don't necessarily need surgery for some of those fractures. As the child gets older, they have less ability to what we call remodel. So the bone remodels based on how its proximity or how close it is to the growth plate. So if it's close to the growth plate, the child may have a better chance of remodeling. If it's far away from the growth plate, the child may have a less chance of remodeling, and also based on age. So if you're young, you have more time for your bone to remodel. If you're older, you don't have as much time. So a 15-year-old doesn't really have that much growth remaining to address the deformity they may have.
Okay. What age is most common that you see fractures? Is it the little babies, or is it the bigger guys that?
So it depends on what the fracture is, but typically I'll see it, and it depends on the nature of the fracture. Typically I'll see it in kids, from about 4 years old, and I'll see it all the way up to kids that are about 15. It really depends on the particular bone that you're talking about, the mechanism of injury. One of the big things that I'll kind of touch on, since we're talking about fractures, is non-accidental trauma, and what that really refers to is child abuse. And so some of the things that I see sometimes are fractures in children that are not yet walking. So that's a concern. If we see that in the emergency room, it doesn't matter how great of a parent you are, if we have a fracture in a child that's not yet walking, we all should kind of take responsibility for that and want to work that up further. And so we're doing that in the best interest of the child, and not really doing it, because you're necessarily a bad parent. It's just kind of the protocol.
Okay, all right then. Now, what sports and My son played football too. But what sports do you really see coming, patients coming into your office because of a particular sport? And what type of injuries, I know they're more common,
Right.
basketball, tennis, football. What are the more common injuries from sports?
So, I see all types of athletes.
Right.
Common injuries that I see are, I'm sure people have heard of ACL tears. So basically, the ACL there are two ligaments that are in your knee
Okay.
that kind of prevent your knee from translating or moving forward or moving backward.
Right.
And one of those ligaments is your anterior cruciate ligament. And that's probably, of the things that I treat surgically, is probably one of the most common things that I see.
Okay.
Is that particular ligament torn.
Right. Healing. Does healing occur, is it easier in the younger child than the teenager? As far as if a fracture happens, how do the bones come together and
Right.
the healing happens?
So that's the great thing about children, and that's why I love working with children. Children have an amazing ability to heal.
Right.
And so a fracture that may take, X amount of time to heal in an adult heals in a child relatively rapidly.
Oh.
And also children are able to rehab much more easily. So of course, the younger the child is, the greater the likelihood that they'll be able to rehab faster. But children in general, their ability to kind of remodel and their ability to get back to their former state prior to the fracture is great.
All right. This is a question that I always, put it this way. How do you handle itching with a cast?
Great question. Probably a very common question that I get in my office.
It's called coat hanger. No.
So
I'm just kidding.
So I usually will tell my parents, and I have a little sheet that I give to all of my parents about what to do and what not to do when the cast itches. Because
Right.
I have found pennies, hangers, markers, the back of pens, erasers, you name it, I found it in a cast.
Right.
So my recommendation, and it really works well, is for parents to take a blow dryer on a cold setting, and you can kind of use that to alleviate some of the itching in a cast. But what you should not do is put any foreign object down the
Right.
cast
I agree.
to address the itching.
Yeah.
So no coat hangers.
No coat hangers.
No coat
Please,
hangers in your
no
cast.
coat hangers. Okay. How do you know, or sometimes, how can you diagnose a fracture as opposed to a sprain?
Great question. So X-ray is probably the number one thing. So if a child presents to me, whether it be through the emergency room or in my office, and they're complaining of pain in an extremity, oftentimes I will get an X-ray, because an X-ray is a way to definitively tell them whether or not they have a fracture or not.
Okay.
So if you get an X-ray, it'll be very obvious whether or not they have a fracture, and then you treat it appropriately.
Okay. What is a hairline fracture?
So a hairline fracture is basically a fracture. It's also what we call a stress fracture. So it's essentially the bones are lined up appropriately,
Right.
and it's related to stress on the bone. So they may just have a small line that goes across the bone, but the bones don't actually completely break, in half.
Right.
And so the bones are lined up perfectly fine. You just will see kind of like this line that goes across that particular bone.
Okay. I remember when I was running track many years ago, and we used to get down here, it used to hurt right here where the bone and the muscle. I should ask you, why does that happen? It's too late for me, but I know I do still hear about that.
Right.
Why does that happen?
The shin splints.
There
Is what you're
you go,
describing, right.
shin splints.
So shin splints, again, they're kind of an overuse phenomenon, meaning that when you do a lot of running, if you're a person that participates in activities that require you to put a lot of stress across, usually it's this bone, the tibia bone that it occurs at.
Right.
You can get what they call shin splints. I don't know if anybody actually really knows what causes shin splints, but what I'm concerned about when I hear about that is what you had described before, which is a stress fracture. So
Right.
and oftentimes I will get an X-ray to make sure that that's not what's going on.
Okay.
If the patient has what we call shin splints and does not have a stress fracture, then you can just treat that with rest.
Okay. Physical therapy. How important is it? I mean, if I have a fractured bone, and do I really have to go to that physical therapy?
So it depends on what the issue is. So I usually prescribe prescribe physical therapy for a couple of things. One, if a patient has a sports injury, like a strain or a sprain, after they've kind of rested, then I will prescribe physical therapy. And it is important. The reason why the patient probably got the injury in the first place is because they're deconditioned, or they're not, their biomechanics are off. They're not doing what they're supposed to be doing to prevent that injury from happening in the first place. So physical therapy is good as far as strengthening, and it's also important, and I often prescribe it for patients for core strengthening, to strengthen the muscles across your abdomen. So depending on the issue, physical therapy is extremely important.
Okay, so it's important for young people out there, because they are always involved in sports, to really get conditioned well, to really go out and practice and get physically fit before you get into the actual season and
Absolutely.
doing what you need to do.
And in addition to that, stretching before and after. That's a common thing that I find that patients don't do.
Right.
You should stretch before and after the activity that you're doing. Especially kids, they have a tendency of just kind of going out there cold, which is not the best thing.
What if the bone does not heal?
So
where do we go?
Right. So I will say this, oftentimes in children, it's very rare that I will see that a bone does not heal. It's a common thing, I wouldn't say common, but it's more common in an adult for a bone to not heal. However, it does happen. So your options are a few things. One, you can just treat them longer in whatever you put them in, whether it be a cast or a splint or whatever they're in. The other option in that case is surgical intervention. And what you can do surgically is you can bone graft that area, which means taking bone either from the patient, or you can take it, from a cadaver, which is basically someone that's passed, that you're using their tissue, and you can use that to fill in whatever the area is that has not healed, and then you basically put them back into a cast, or sometimes you have to put, if you treated that fracture originally with plates or screws, you basically will essentially put the hardware back in until it heals.
I know with adults, they often have decreased calcium in their bones. Is that something that you have to deal with very often as far as pediatrics?
It's actually very controversial. It's something that we're going to be studying soon, but it's also things that have been a topic that's been studied in the literature, how being vitamin D deficient affects bone healing. So, I oftentimes encourage my patients, if they've had a fracture, to make sure that they are getting adequate vitamin D and calcium. If they're taking a multivitamin, that definitely helps. If they have, I usually don't do more than that unless they're having, repeat episodes of fractures, then it's something that I might work up. But aside from that, I usually don't.
What if the bone heals wrong?
And that happens.
I have patients it's just like crooked, and we have to do something.
Right. So again, that's one of the great things about children. So children again have the ability to remodel because of their growth plates. So it really depends on the age of the child. If it's a very young child that for some reason had a fracture and never presented to me until the fracture already healed, and now it's in it's malaligned. In those particular cases, I will give the child a chance to remodel. If the child is 4, they have a long time for that bone to remodel. And then if at the end of skeletal growth, there's still a little bit of a deformity, which doesn't happen commonly, but if there is, you can always address it then. But you should always give them a chance to remodel. You don't necessarily need to do anything about it at that time.
The muscles and the nerves, when a fracture, you have a pretty bad fracture, how do you take care of the muscles and the nerves around that bone?
Right. So typically what can happen, and I talked about that specific elbow fracture, and I'll use that as an example. So for a fracture that occurs, what we call that supracondylar humerus fracture, which is a fracture that occurs at the lower part of this bone here, which is the humerus bone. There are nerves that run around there that if the fracture is really out of place, if it's displaced quite significantly, can be stretched. And so in those particular cases, the patient will go to the operating room. You will reduce the fracture, which means you put the two bones back into the place that they belong. And then you basically fixate them. You use something to hold the bone in the appropriate position. So sometimes after that happens, the patient will have, after the surgery, some loss of function because of that nerve injury. Usually what happens is that nerve function will recover over time as long as the nerve is not cut. As long as the nerve is not severed, that should recover over time.
Okay, all right. Why do you have Why do you feel it in that fractured area after it's healed when it's rainy outside?
You know, I don't have a good answer to that
All
question.
right.
I do oftentimes hear that. I usually hear that when I put metal in. Like if I have to treat somebody and they have like a plate or screws, they will oftentimes come back and complain of that, and I don't have a great answer for that.
Okay. Once you fracture a bone, will it heal as strong as prior to the fracture?
Yes.
It will.
I get asked that question all the time, and the answer is simply yes.
All right, all right. How do most patients present to your office?
So most times patients usually present to the emergency room first if we're talking about fracture care.
Okay.
They've fallen, they fractured a bone, they present to the emergency room, they're treated and splinted, and then they're told to follow up with me in my office.
Okay, all righty. And is there, and we're almost out of time,
Okay.
so we're gonna
Sure, let's go.
run with these last couple questions. Family history, is it important?
Of course, family history is important, and you should always ask the question. There's certain diagnoses such as osteogenesis imperfecta is one in particular that does have a family history, and those patients have a predisposition for fracture, so you should ask about family history.
Okay. And prevention, is there anything that's key in preventing pediatric fractures?
You know, I think the biggest thing is to just keep an eye on your children while they're playing. Unfortunately, kids are going to be kids.
Right.
They're going to injure themselves every now and again. But, you know, keep an eye on them. Make sure they're not running across the street without being supervised.
I got you.
And all those kind of things.
All righty. Listen, it was a pleasure, and thank you very much for coming in talking about pediatric orthopedics.
Thanks a lot. Thanks for having me.
All righty. Well, in closing, remember, knowledge is key, but action is power. So obey your doctor. Go see your doctor. If you have an ailment, if you are having a med moment, go see your doctor. Remember, sharing and caring. Let's care about each other. Let's share our medical moments and continue to help each other so that we all be healthier. Look at me on as far as the website is concerned, www.obeyyourdoctor.com. Never institute any change in your medical care until you see your doctor. I trust each and every one of you continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. All right.